You've probably heard people use the terms panic attack and anxiety attack like they're the same thing. Hey, maybe you've even done it yourself. It's a super common mix-up, but here's the thing. They are actually very different experiences. So let's get to the bottom of it and clear up the confusion once and for all.
So what is the difference really? And why does it even matter? Well, knowing which is which isn't just about getting the terminology right. It's about really understanding what's happening in your mind and your body. And that, right there, is the very first step toward managing it.
And here's the main takeaway, right up front. Even though they can feel similarly overwhelming and share some symptoms, from a clinical standpoint, they are absolutely not the same thing. One is a formal diagnosis you can get from a doctor, and the other, well, it's a very real experience, but it's not an official term. Let's unpack what that really means.
Okay, first up, the panic attack. The most important thing to get straight is that this is an official clinical term. You'll find it defined in what's called the DSM-5, which is basically the official handbook that mental health professionals use to diagnose conditions. So this one is in the books.
So what is it? A panic attack is the sudden, intense wave of fear that just hits you, seemingly out of nowhere. The key here is that it triggers very real, very severe physical reactions, even when there's no actual danger in sight. It's like your body's fire alarm is screaming, but there's no fire.
And believe me, those physical reactions are no joke. We're talking about a heart that's racing so fast you might think you're having a heart attack. There's chest pain, dizziness, sudden hot flashes or chills, and intense shaking. It's an absolutely overwhelming physical experience that can be incredibly terrifying.
And what's going on in your head is just as powerful. People often report feeling a total loss of control, this sudden gut-wrenching fear that they're about to die, or a really strange feeling of being detached from reality, kind of like you're watching a movie of your own life instead of living it. All right, let's flip the coin and talk about the anxiety attack. Now, here's the most important distinction. This is not a clinical term. You won't find it in the DSM-5. But, and this is a big but, that doesn't make the experience any less real or valid. It's just crucial for understanding how we talk about it and treat it.
So when people say anxiety attack, they're usually describing a time when their anxiety becomes super intense and overwhelming. But unlike that out-of-the-blue panic attack, this experience often builds up over time. It can simmer for minutes, hours, or even days, usually ramping up because of a specific worry or stressor.
The symptoms here can feel a little less intense than a full-on panic attack. But here's the trade-off. They often last way, way longer. We're talking about a constant feeling of nervousness, being on edge, trouble concentrating, and that nagging sense of doom that can just hang around for days or even weeks.
Okay, so to make this crystal clear, let's put them side by side. This is where you'll really see the differences click into place.
You know, maybe the easiest way to think about it is this. A panic attack is a sudden strike. It's an explosion of fear. An anxiety attack? That's more of a slow burn. It's a worry that gradually builds and builds until it feels like an out-of-control fire.
This chart really breaks it all down. Let's look at the trigger. For a panic attack, there might not even be one. It can come completely out of the blue. Anxiety, though, is almost always a reaction to a stressor. Then there is the onset. Panic is sudden. Anxiety is gradual. The symptoms of panic are incredibly intense and disruptive, while anxiety can range from mild to severe. And maybe the biggest telltale sign is duration. A panic attack is usually over within minutes, but those feelings of anxiety can stick around for a very, very long time.
Now, here's where it gets interesting. Even though the experiences are pretty different, the things that cause them, the underlying risk factors, can actually be very similar. So let's dig into what can lead to both.
It's almost never just one thing, right? It's usually a mix of stuff. We're talking about big life stressors or past trauma, ongoing medical issues, or maybe a family history of mental health challenges. It could also be related to substance use, or even something as simple as way too much caffeine. Our genes, our biology, and our life experiences all have a part to play.
And get this, the research shows a pretty clear difference in who is most affected. Women are actually twice as likely as men to develop an anxiety disorder. That's a huge statistic, and it really highlights how these conditions can impact different groups of people in different ways.
Okay, so we've defined the terms, we've looked at the causes. What can you actually do about it? Let's talk about the toolkit, the strategies and treatments out there to help you manage these symptoms and get back in the driver's seat.
So in the heat of the moment, when you feel one of these episodes coming on, these 4 steps can be a total lifeline. First, just acknowledge it. Tell yourself, okay, this is happening, and it will pass. Second, get control of your breath. Slow, deep breaths can work wonders on your nervous system. Third, try some simple relaxation techniques. And fourth, practice mindfulness to stay grounded right here, right now.
Now, for long-term management, getting professional help is so important. This often looks like a combination of psychotherapy, like cognitive behavioral therapy or CBT, which helps you retrain your thinking patterns, and sometimes medication. Doctors might prescribe antidepressants or, in some cases, short-term sedatives.
And speaking of medication, it is absolutely critical to be informed. This is a direct warning from the FDA about a specific class of drugs, and while they can be effective for some, they carry some really serious risks. This is exactly why working with a medical professional who knows your history is completely non-negotiable.
Whew! We have covered a lot of ground, from definitions and symptoms all the way to coping strategies. So now, let's bring it all home and talk about the single most important next step you can take.
If there is one thing you take away from all of this, please let it be this. A professional diagnosis is everything. It's the only way to be sure about what's going on, to rule out any other medical issues, and to find a treatment plan that is built specifically for you.
So, now you have the map. You can tell the difference between a panic attack and an anxiety attack. And just like with anything else in life, understanding is the first, most powerful step. So the real question is, what will be your next